The broadcast is now starting. All attendees are in listen-only mode.
Hello, everybody. Welcome to the webinar today. Thanks for joining us. My name is Pip Marks, and I'm the Project Director for Family Voices of California, and I'll be hosting today's webinar. But before I introduce our wonderful speaker, Dr. Lucile Turk, I will just like to tell you a little bit about Family Voices of California. I'll just move my slide here. So we're a statewide coalition of locally based parent-run centres working to ensure that children and youth with special healthcare needs receive quality healthcare. And as the state affiliate of the National Family Voices, we are California's federally funded family-to-family health information centre, and we provide statewide support and resources to families with children with special needs. Our webinars are statewide trainings on various health topics regarding children and youth, and they're geared towards families, professionals, parent-to-parent resource staff, advocates, a real diverse group. Sorry, I seem to have problems moving my slides forward. So a little bit about the platform that we're going to be using today. If you have any technical difficulties, please call that number that you see on the screen. That's GoToWebinar. It'll go directly to them. And due to feedback issues, we have everybody on mute from our end. But throughout the webinar, please feel free to type in your questions in the little box on the right-hand side of your menu. We'll stop periodically to address your questions and also save some time at the end. So today's presentation is being recorded and will be posted on our Family Voices of California website along with Laurie's PowerPoint slides. And after the webinar, you're going to be emailed a very short evaluation survey, and we thank you in advance for taking the time to give us your feedback. It really is invaluable to us. So it's now my pleasure to introduce today's speaker, Dr. Lucile Turk. Welcome, Laurie. And I'm just going to read your bio first before you start, Laurie. So Laurie is a Senior Manager for Kidsdata, a program of the Lucile Packard Foundation for Children's Health. Laurie promotes data-driven decision-making and action to improve children's health and well-being, and she contributes to the quality, relevance, and utility of the data and the content on kidsdata.org. Before joining the foundation, Laurie was a senior researcher at American Institutes for Research. She has extensive experience with data collection, analysis, and reporting for education, social services, and other research projects that support children's long-term health and development. And prior to her work and research, Laurie was a middle school social studies teacher. So welcome, Laurie. I'm going to change the presenter role over to you. And I really appreciate you taking the time to present today.
Thank you very much. I'll switch it over to my screen. Okay. And thank you for giving me this time to talk to you today about children with special healthcare needs and the data that informs about them. I will first provide you with a general overview of Kidsdata and the type of data that we have about children with special healthcare needs, or CSHCN. Then I'll talk to you about some pointers for using data to inform action. And last, I'll do a live demonstration of kidsdata.org to show you how you can access data yourself. Kidsdata is a program of the Lucile Packard Foundation for Children's Health. Our foundation's mission is to elevate the priority of children's health, and its vision is that all children will reach their maximum health potential. We pursue this in 3 ways. We support the Lucile Packard Children's Hospital. 2, we have a deep focus in children with special healthcare needs, and specifically, we work to improve the systems of care, care coordination, and family engagement. And 3, we have the Kidsdata program, where we maintain a broad focus across health and well-being issues affecting children. And this is what brings me here talking to you today. So why does Kidsdata exist? Our entire motivation is improving children's health and well-being. Through kidsdata.org, we provide data and information to support work on behalf of children. It can be a challenge for policymakers or program staff, advocates, or others to quickly and accurately use data to support their work. So we do this data work for them and for you to bring together data from many reputable sources into one place where it's easy to find and use for your purpose. Then you have more time to spend doing the important work of supporting children in a way that you are the expert. Overall, on the website, we cover 56 children's health and well-being topics, and 5 of those are specifically on children with special health care needs. Depending on the data, we have multiple regions. So we have for California, county, city, school district, and legislative district. And we also have by demographics, for example, by gender and by race ethnicity. I have to admit that for the CSHCN data, we aren't able to offer lower levels of regions and data broken out by demographic groups as often as we'd like. Because of small populations, we cannot always get reliable estimates at the smaller levels. But you can be rest assured that if we make the data available to you, then they are estimates that you can trust. The last thing I'll mention here is that for every topic, we provide context and recommendations. And these are short sections that describe the issue and how children are faring, and I'll point this out to you later during the live demonstration. The 5 topics that we have on Kidsdata that are specifically about children with special health care needs is characteristics, access to services, insurance coverage, impact on children and families, and quality of care. In the following 5 slides, I'll describe the type of information that you can find under each topic, and I'll provide an example of a data finding within that topic as well. The first topic is characteristics of children with special needs. As I said, the next 5 slides will have the same format, so I'm going to take a minute to describe the layout of what you're seeing here. On the right side, you see a sampling of the type of information that you'll find under this topic, and there's often more information, but this gives you a sampling, an idea of it. On the left-hand side, I'm sharing one data finding that's within this topic. I'm sharing the information to you in this way across the set of slides for a few purposes. 1, to understand the type of CSHCN information that's available to you on kidsdata.org. 2, to learn about one data finding in this area. And 3, to see the types of figures that are available to you through the website. I'll be showing you 5 types of figures across the 5 slides, and then later I'll show you how to create them during the live demonstration. So, in this topic, characteristics of children with special needs, you'll see information on the CCS program, or the California Children's Services Program, demographics, emotional difficulties, prevalence, special education, as well as a few other pieces. Let's look a little closer at the CCS program and how stable it has been in enrollment over time. In 2009, there were about 25,000 babies in the program that were under age 1 that were active in the CCS program. For older children, ages 1 through 21, there was about 125,000 in 2009. Across time since 2009, the enrollment has been fairly stable for babies, and for the older age group, it has been increasing, except for a slight dip in the last time period. The second topic is access to services for children with special needs. In this topic, we cover early intervention, mental health services, referrals to specialty care, transitional services, and unmet needs. Are needs being met among children with special health care needs? Not well enough. About one quarter of children with special health care needs had one or more unmet need in California. This means that they did not receive a special health care service or equipment in the previous year. The third topic is insurance coverage for children with special needs. We cover information such as adequacy, consistency, and type of insurance. How adequate is insurance for children with special health care needs? Just over 2/3 of children with special needs have adequate coverage in California, which is slightly less than in the U.S. as a whole, where 71% of children had adequate coverage. And both of these percentages are lower compared with children that did not have special health care needs. Our fourth topic is impact of special needs on children and families. Some of the information that we cover in this topic are daily activities, education, emotional stress, financial problems, and parental support. Stress can be one of the impacts on families who are caring for children with special needs. In some parts of California, some families are feeling greater stress than others. 28% of children with special needs in California had parents who experienced stress from parenting. Using a map of California, you see darker shaded areas here are areas of greater concern. They're areas where parents are experiencing more stress than other areas. And as a comparison from another part of the website, this compares to 12% of children who did not have special needs that the parents experienced stress. Now, there's a couple of other things that I want to point out with this map. One of them is it shows an example of applying legislative boundaries to a map, which is shown by the darkened lines. Legislative boundaries may be important in your work if it is to convince legislators of change. And here you see state Senate boundaries in the bolded lines. This map also shows an example of missing data, which demonstrates the need to pressure for more data on this population. You see large swaths of California that simply has no information. Our fifth topic is quality of care for children with special needs. Types of information in this topic are care coordination, family-centered care, medical home, quality standards, and shared decision-making. Family-centered care is important for all children, but is particularly important for children with special health care needs because of the key role families have in their children's health. However, not all families report the same experiences. 70% of white children receive family-centered care, but only 59% of Hispanic children and only 52% of African American children. 70% is too low, but with only half of African American children receiving this level of quality care, there is an inequity that needs to be addressed. Now, change gears a little bit here and talking about using data to inform action and how can you use data to support your message. You can use data to address commonly held values, and some of these values are access, or who has access to services or programs and who does not have the access. Equity, are resources equitable across groups or regions. Quality, what is the quality of the environment or the services? Rights, what are the rights of community members or others? And cost, what are the costs to the community, taxpayers, businesses, or individuals? You don't need to address all of these values, and in fact, having a tight message about one or two is probably the best way to go. It partly depends on whether you're making a short speech or an issue brief versus a long inclusive report, and it also depends on who your audience is. The figure that you see below here addresses both access and equity. Children with more complex needs, meaning that they need more than just medication, have more difficulty accessing community-based services than children with less complex needs. Even when you think with nearly 1 in 5 children with less complex needs, there's a problem in access. Too many children are not getting what they need from community-based services. But to top it off, with a nearly 25 percentage point difference between children with less and more complex needs, we have a problem with equity in accessing services. Complexity should not be a determinant of accessibility, but these data suggest that there is. For the CSHCN population, not having data available to you is a common problem. So this is something that this group might need to spend more time thinking about than most. If data are not available, then what can you do? You can use proxies, and you can advocate for more data. If you find an opportunity, perhaps you're talking to legislators or agency personnel or survey administrators or others, then please do speak up about how more data would benefit your work and benefit children's outcomes. For proxies, more immediate, you need to show some evidence now. Proxies are data that can substitute for the information that you need because they're closely related to your issue. For example, if you want to identify how many CSHCN students are at risk for falling behind grade level on academics, but you don't have academic scores, then a proxy could be number of missed school days. Research suggests that children who have higher rates of absences are more likely to fall behind grade level. So here we have a particular concern for students represented by the turquoise part of the pie towards the top there, who missed 11 or more days of school. That's almost 13% of CSHCN students. How can you make your message stronger? When formulating your message, you want to make sure to address both the mind and the heart of those who are trying to convince for change. The data is for the mind, but the stories speak to the heart, and different people can be influenced by different parts of your message. Use stories with your data for a more powerful message. And here I'll pause to see if there's any questions before I start on the live presentation.
Oh, yes, Laurie, can you hear me?
Yes, I can.
Okay, yes, we do have a question. Let me just open that up. For the definition of more complex needs, it was defined as more than just medications. Does this include autism and ADHD where behavioral interventions and OT might be useful?
I believe it does, but I should double check that and get back to you.
Okay. And then another question was about the data sources where they, at the end of your slides, at the bottom it said data source, Child Evidence and Health Measurement Initiative, for instance. Are these larger data sources, national organizations, are they surveying families directly? I mean, where is their data coming from?
It depends on which one you're talking about. For example, quite a bit of our data comes from the National Survey of Children's Health for the special needs population. So that is a survey that does go out to families and they're asking about their children.
Okay, that answers the question. Thank you. No other questions that I can see so far.
Okay, so I'll go ahead and switch, or actually, first let me introduce you to that we're about to go into the Kidsdata site. And are you on mute, Pip? Okay.
I can be muted or unmuted, whatever you need me to do.
Okay, I think mute works better because then it doesn't have the... Okay, thank you. So we will go into how to access the data. And to direct our thinking about this, we'll just think about a question. Where should I target outreach to promote adoption of the medical home model? Medical home model, the definition is that it's primary care that is accessible, continuous, comprehensive, family-centered care, coordinated, compassionate, and culturally effective. So now, with this question in mind, we'll go over to the website. Actually, okay. And this is the homepage on the website. We organize the data in 3 different ways, and I'm going to be spending most of the time talking about the data by topic section, and I'll touch on the other ways that we organize the data a little bit later. We organize all of our topics in 8 different categories, which you see here. And the children with special health care needs is the one that I'm going to go into since it's the special interest of this group. I click in here, and in orange, we see our topics. So we have 56 topics, as I said before, and these are the 5 with special health care needs that I already discussed with you. I want to point out on the side over here, there's these summary buttons. And if you click into summary, then you receive a high-level perspective of that topic. On the left-hand side, you see all the indicators that are available in that topic. And in the middle, there is a slideshow which will present some high-level findings, some compelling findings that we are presenting to you. In addition to that, you can learn some additional information about the topic by clicking into these areas, which I will get into a little bit more later. At the top, there's a topic summary, and every single topic has the same topic summary button up in the corner there. And with this, it is a 2-page PDF, which gives you an overview of what the topic is about. Also, we present some figures with some key compelling findings. So with that, I'm going to go back here to the data by topic page. And recall our question was that we wanted to think about how to target our outreach to promote the medical home model. Medical home model is under quality of care. So I'll click into here, and in blue, these are our actual indicators. This is where you'll find the actual data. At the bottom, we have receipt of care within the medical home model, and I will click into here to find our data. So talking about, you'll always first be presented with a table. So we see that 36% of children in California receive care within a medical home model. On the left-hand side, there are different geographies, and this is where you can refine exactly what you want to see. If there's a plus sign, that means there's additional geographies lower than the county, which you can also click to see that information as well. If you want to quickly see how the counties are ranking, click on this, and then it sorts it by county. So we see that Imperial County, it's around 30%, and these counties here may be areas to target some additional outreach in terms of the medical home model. Compared to the bottom, in Marin County, over half of the children are receiving services in the medical home model. Now, a couple of other things to point out. Below every figure, we always provide definition, source, and notes. This part is very important to read through so that you have a full understanding of the data before using it. First, the definition and data source, but I want to say a little more about the footnote section, actually. If there's caveats about the data, something additional to understand, we always put it in this section. We are cautious with the data that we show, so if we have serious concern with the data, either because something with the survey or maybe there was a break in a trend or whatever it might be, then we don't present the data on the website at all. But if there is something just to be aware of, so as you use the data, we will put it in this footnote section. So that is an important section to read through. In addition, and I mentioned this earlier, we provide this for every topic, which is the narrative section to understand the topic a little bit better. So in this case, for quality of care with special health care needs, I'll just go into a few of these. We have a few paragraphs on why this topic is important. This is a national perspective, research-based description, usually just 2 or 3 paragraphs, explaining about the topic. How children are faring. This is also just a few paragraphs from the California perspective and based on the data that's on Kidsdata. It's basically taking some of our data points and turning it into a narrative to provide you with an overview. Policy implications. This gives you some bullets, also research-based, of what are some things to consider in policy or in programs, and also perhaps sometimes some what works well type of pointers. And last in the narrative section, we have the research and links. If you want to learn even more about the topic than what we provided above, then we've put together reports, websites, and other information to provide you a deeper dive. They're all reputable sources outside of our own website where you can learn more on this very specific topic. Let's go back to the top, and I'll point out a few other things. One of them is the types of figures that you can generate, and these I demonstrated the 5 during the PowerPoint earlier. So here we see table, bar, and map The other two options were pie chart and trend line. These data here, they're not appropriate for that type of figure, so we just simply don't have that available to you. We can click over to bar if that's how we prefer to see the data. And so we see it here, and you can sort it by different ways if you prefer. Also, we could see it by map. And then we have our map here. For this map, you can hover over to see specific information, or you could click on the side if there's a particular county that you wanted to bring up. So here, this is another nice way to really think about that question about targeting outreach to promote the medical home model. In this case, the lighter shades means lower percentages of children who are receiving care in the medical home model. So it's areas of greater concern. So we see this area right here in the Central Valley. This could be an area for targeting, as well as down here in the Imperial Valley area. Also notice, once again, we have large areas with no data because sample sizes are just so small, we're not able to provide reliable estimates for those areas. Legislative boundaries, something that I mentioned earlier, this is where you can go in and select the type of legislative boundary that you want to put onto your map. It's an overlay, so you could either do for all the boundaries, or if there's a particular legislative district you want to highlight, you can enter that in specifically. Now, let's say you've made your map, this is what you wanted, you want to run to and do a presentation about it. You can do that through here in Download and Other Tools. You can copy whatever figure you have put together here in Kidsdata and put it into a Word document, and automatically the definition and notes will go along with it, or the definition and the data source. Or you can put it into a PowerPoint. Another option is you can put it into an Excel spreadsheet. It's a formatted Excel spreadsheet. Another option is, recall that I showed you that two-page PDF. You can get that two-page PDF and include your specific graphic on the bottom of that. So that might work well if you're tabling, or if you're going to a meeting where you want to provide both an overview plus your specific point that you want to make with the data. Last, if you have a website and you've designed the figure the way you want it to be, and you'd like it to be on your website, you can use this embed function by clicking here and then putting it onto your website. And then every time that we update the data on our website, it will automatically update on your website. Now, to point out other ways to access the same data, we've got the data by region. So let's say, there we go. Let's say you're really most interested in anything about your particular county. So you can click into your county and bring it up there, or into a city or a school district, and you can see all the data that's available for that particular region. Similarly, data by demographic. If you're really interested in a particular demographic, you can bring it up here and look at all the data that is available for that particular group. I'm going to click into this one, and the layout of the page is same as data by region, so I'm just going through it once in the data by demographic section. And in this section, you'll see everything related to infants. On the left side, these are our categories, so you can click onto a different category depending on what you're most interested in to see. And then on this side here, this again, we've selected a few highlights that we think is particularly compelling data in that category for this group. If you wanted to see all the data, for example, about infants and child safety, you would click here. Or if you just simply want to see all the data period about the demographic group, then you click at the bottom, and then you'll receive all the data about the particular region or demographic group that you've selected. One other thing that I want to point out here is on the top here, there's demographic group sheet, and when you're in the data by region, you'll see similar, a region fact sheet, just very similar to what you saw as a topic fact sheet. And that looks like this here. This is the fact sheet that was developed for the topic children with special healthcare needs. And it highlights some data that compares what is happening in California as compared to the United States. So that's another option. Coming back here, so we have covered the 3 ways that the data are organized. The same data is organized in kidsdata.org. And I want to point out some other separate things. If you want to search for data, you can search for it in this bar here, or go to an A through Z index and scroll to see what's available. And in here, we have data in action. In the Data in Action page, this covers the type of information that I covered in the middle part of my earlier presentation, how to use data for action. So you'll find that in these clicks in here, those 3 points that I already covered, as well as some additional points as well. Also, there's tips for using Kidsdata, which will give you more ideas of how you can use Kidsdata in your work. And here, Kidsdata News. We do have a newsletter called Kidsdata News that goes out twice a month. And in that newsletter, it's short, 2 or 3 paragraphs, and we cover a compelling data finding that we've seen in the data lately. And also, this is where we show what's the data that we have been releasing lately. So we'll provide that at the bottom of our Kidsdata News. Our latest Kidsdata News actually is a little bit different because we do have another webinar coming up. If you are interested in youth in schools in particular, this is all students, not just special needs, then on November 8th, we do have a webinar coming up that will be in partnership with WestEd, talking about youth in schools, about data that's across a dozen topics. I'll pause again, see if there's any questions.
Well, thank you, Laurie. I'm embarrassed to say I have lost my, as the organizer, I've lost my little question pane box. So I think Eileen has a question. Eileen, I'm going to try and unmute you. Eileen, can you hear us? Eileen? I don't know if she's...
Am I able to see it on my side? I don't think I am, right?
No, and I don't know what's... Something went down while you were presenting for me as an organizer. I'm just going to ask, I know Alison, I'm going to ask you to make you an organizer to see if you can see the question pane. Are you able to do that?
You can try. I don't see it right now.
No, I don't know what's happened to it. So
And I see a question pane, but it's not for all questions.
I don't know.
We can make sure also to respond to all the questions and then send it out as to all the attendees too, so that they'll be able to see responses.
Yes, for some reason something has happened. Eileen Yamada, you are unmuted, so I've opened it up for you to ask your question if you would like to. And what we can do, if people can I'm sorry about this, if people can email their questions and then I'll send them on to you, Laurie.
Okay, that'll be great.
Okay.
I should be able to turn that around to you pretty quickly.
Okay, so back to you. I'll mute myself again.
Actually, that was the end of my presentation, unless there's anything more you feel like that that you would like to see.
I do have a question for you, Laurie. How often is the data updated? I mean, is it constant thing for you, or?
In the office, yes, it's constant. We're continuously updating data. We do have about over 600 indicators on the website across the 56 topics, so it is a lot of data. So it's continuous work for us. It depends on the data source when the data is updated on the website. Some of it is every year, some of it's every other year. Sometimes, for example, from the National Survey from Children's Health, I talked about that one before, we'll take 2 survey years of data together so that we can improve our sample sizes to produce more estimates. So we've had one cycle of that survey where we actually just received the data for the latest cycle this week. But it will take a couple of months before we can go through it and make the data available to the website. So that one, especially for special needs, we often have to combine 2 years of data or more in order to have reliable estimates. So that's why you do see some older data up there. It takes time for us to have enough sample to be able to present the data.
Okay, thank you. Well, again, I apologize for having lost our question capability. But thank you, Laurie, for presenting today. It's excellent. It's outstanding data, and I know that I will definitely be using it in my work. So everybody, this brings our webinar to a close. If you could take the short evaluation survey after you've closed out, that would be fantastic for us. It's really invaluable information. Have a wonderful day, everybody, and thank you again, Laurie.
Thank you very much. Bye.